When an adult has hypoglycemia, the dosing of dextrose is easy. You just give 1 ampule of 50% dextrose, or D50, which is 50 milliliters. But when an infant or a child has hypoglycemia, we don't want to use 50% dextrose. Why not? Well, the osmolarity of D50 is very high, and it can cause the cells in the lining of small blood vessels to become damaged. This is called sclerosis. No one wants to injure a child's blood vessels, so we need to give more dilute dextrose to a child or infant. This can cause anxiety because now we need to know which solution to use as well as the correct dosing. But never fear, we're going to simplify this by using a small, medium, large approach and the rule of 50. Dosing and concentration of dextrose is categorized by 3 age groups: small, which is newborns and infants; medium, which is toddlers and school age; and large, which is teenagers and adults. The rule of 50 states that you should use a dose in milliliters per kilogram that, when multiplied by the concentration of dextrose, equals 50. So, for instance, if you're using 10% dextrose, or D10, you should give 5 milliliters per kilogram, because 10 times 5 is 50. Similarly, if you're using 25% dextrose, or D25, give 2 milliliters per kilogram, because 25 times 2 equals 50. If you're using D50, give 1 milliliter per kilogram, because 50 times 1 is, of course, 50. For our group in the first year of life, with their delicate little veins, we'll use the small concentration of D10 at 5 milliliters per kilogram. For children who are no longer infants but not yet teenagers, we'll use the medium concentration of D25 at 2 milliliters per kilogram. The veins of this age group are a little larger and can tolerate the higher osmolarity of D25. For teenagers and adults, we can use the large concentration of D50 at 1 milliliter per kilogram. If the patient weighs more than 50 kilograms, we'll just standardize the dose at 50 milliliters. Let's apply this to some scenarios. What concentration and dose of dextrose should be given to a 6-month-old boy weighing 7 kilograms? He should be given 35 milliliters of D10. This patient is an infant, so D10 with a dosage of 5 milliliters per kilogram is needed because, according to the rule of 50, 5 times 10 is 50. So a 7 kilogram patient needs 5 times 7 kilograms, which is 35 milliliters of D10. What concentration and dose of dextrose should be given to a 7-year-old girl weighing 25 kilograms? 50 milliliters of D25. This patient is school age, so D25 with a dosage of 2 milliliters per kilogram is needed because 2 times 25 equals 50. Since the patient is 25 kilograms, she needs 2 times 25, which is 50 milliliters of D25. What concentration and dose of dextrose should be given to a 13-year-old boy weighing 45 kilograms? 45 milliliters of D50. This patient is a teenager, so 50% dextrose with a dosage of 1 milliliter per kilogram is needed, because, according to the rule of 50, 1 times 50 equals 50. So a 45 kilogram patient needs 1 times 45, which is 45 milliliters of D50. Could you give D10 to everyone just to be safe? Sure, but the reality is that most code carts only stock D50. One workaround for this is creating a dilution in a 50 milliliter syringe. To do this, draw up the amount of D50 that equals your desired final concentration in a large syringe and dilute it to 50 milliliters. For example, if D10 is needed, you should get out your 50 milliliter syringe and drop 10 milliliters of D50. Then you would add 40 milliliters of sterile water to get a dilute 50 milliliters of solution. Voila, you now have 50 milliliters of D10. To make 25% dextrose, drop 25 milliliters of D50 and then add 25 milliliters of sterile water to get 50 milliliters total. Now you have 50 milliliters of D25. Make sure you label your new syringe to avoid any confusion. The rule of 50 makes pediatric dextrose administration so much easier. The next time you have a sick kid with hypoglycemia, don't be intimidated. Use the rule of 50 and get that blood sugar back up.